Hello, Mrs. Jones. I'm Gina, your nurse. Your provider has informed you that you are experiencing a DVT in your right leg. Is that correct? Okay. So I wanted to go over some information about DVTs with you. A DVT is a complication of surgery. Post-operative patients can experience a DVT. And a DVT is a blood clot that forms in one or more of the patient's deep veins, usually in the legs. There are several causes of DVT that can occur post-operatively, including dehydration, immobility, obesity, trauma, such as surgery, history of thrombosis, hormones, indwelling venous catheters, and more. It's important that we treat the DVT to prevent dangerous situations where the clot can break from the vein and travel up to the brain. Break free from the vein and travel up to the brain or lungs. That is a situation that we want to prevent. We most importantly want to avoid. Some of the symptoms related to DVT are pain, edema or swelling, redness, and warmth at the affected area. These are all symptoms that you're experiencing now. So the first intervention to treat the DVT in your leg is to start you on anticoagulant medication therapy. This will prevent the clot from growing and also prevent other clots from forming. Also, it's important that you start getting out of the bed and walking the hallways, as well as continuing to wear your compression stockings. This will promote blood flow to your leg and reduce the swelling and pain that you're experiencing. One thing you do not want to do is massage your leg, because this can cause the clot to break free and travel to your heart or lungs. Again, we want to avoid that. Okay, so now before I go into more about your medications, do you have any questions about DVTs? Okay. So you are going to be placed on a few medications. Two are heparin and warfarin. Heparin will be given you through IV to prevent the clot from growing and other clots from forming. The second medication, warfarin, is an oral medication that will also prevent clots from forming. Because these medications prevent clots, they also thin your blood and can cause bleeding. So it's important that you are mindful of any signs of bleeding or even bruising, and let us know immediately if you see more blood from the incision site. I will also be monitoring you for any signs of bleeding as well. While on this medication, it's important that you also take measures to reduce the risk of bleeding. So that means it's encouraged that you use a soft toothbrush and an electric razor for shaving to reduce your chances of bleeding. Depending on how severe your DVT is, the provider may order a thrombolytic medication that will dissolve the clot in your leg. We will go further into detail if that's ordered. Do you have any questions? Okay then. I'm here to help you if you do. Thank you, Mrs. Jones. I'll be with you shortly with your medications.